Welcome to the OrthoEd segment 6. This time we're talking about diagnosis and treatment planning, and that's because I just came back from Melbourne. We got to see all the people doing it. There's about 60 people in the room. OrthoEd Module 1 with Dr. Jeff Hall. So before we get started with the segment, I wanted to mention a few things. When I actually went to this course, Module 1, it's in Melbourne, and it was sunny, it was beautiful, but it had rained literally since I left home, and I live in mid-north coast, New South Wales. As you probably heard, it flooded pretty bad. So this quarter, Dental Head Start's going to be donating the little bit that we donate, and a little bit more from my pocket, and hopefully a little bit more from yours, towards the flood victims of New South Wales over that time. The other thing is, and the point of this is just my journey in learning orthodontics. It's my journey in getting orthodontics as well. But this is not made to be your education, and anything I say is just my experience and things I'm expressing my own understanding at this time, and that could change. So if you want to understand orthodontics, reach out to OrthoEd. If you're less than 5 years out, you can get 10% off through Dental Head Start. Find whichever journey it is you want to make sure you understand what you're talking about with orthodontics. And that brings us to kind of what I want to discuss. My favorite saying, I've said it many times, is we don't know what we don't know. We can't see the things that we don't yet understand. And I think the point of this is, one, to stay humble and make sure that you're still learning and that you recognize you don't know everything, but at the same time to continue to have that drive to improve. And ortho is a great example of this. We don't get taught ortho particularly well at university. We get the foundations, obviously, but to be able to provide that for our patients, there's a whole nother game and a whole nother level that we have to understand. And if we don't understand that, we could, and I think really commonly, we miss things in our patients, our general patient population. We don't see issues that might arise in the future for our younger patients, or we don't see the potential to help someone who's a little older who wants that alignment, and they don't even know it's possible. But worse still, we may be doing something and not yet see the complication that's about to arise because we don't understand enough. And that's where orthodontic, diagnosis, treatment planning is just such a crucial, foundation of what we're talking about. So something simple, I learned from this is molars. The ideal rotation for it is so that the distobuccal cusp and a line that passes through distobuccal through mesiopalatal should intersect the canine. And if your rotation of that molar isn't quite right, it might change your whole anterior-posterior relationship of the sixes. Simple things like that, I personally did not know. Another thing that's really I found really interesting, and Jeff talked a lot about, is when you're diagnosing a class 3, it's important to find out whether that's a pseudo class 3 or a genuine class 3. Genuine class 3s, as all orthodontists say, is really difficult to treat. It's something I'm never planning on treating. But there are cases where patients are posturing into class 3 because of the relationship of their teeth. And if you can get them into the CR relationship, you might find that it's a pseudo, and therefore it may be perhaps a simpler case. Again, making that diagnosis, you want to make sure you get it right. But if you do, that might simplify everything. And Jeff talked about a couple of really interesting ways to diagnose this. And the main way is using 2 lateral cephs. I'd never heard this before, but if you take one of them and they're in MIP, so the teeth, they're intercuspating, they're as closed as they can be, you're getting the vertical dimension. But then you can do one in CR, and that gives their true sagittal position of their teeth and their jaws. This brings us to that really important question, do we need lat cephs? And again, this is not, advice on actually how to do it, but what, Jeff is talking about, and what he talked about in one of the previous OrthoEd segments, is that a lat ceph is, it's really important for many reasons, but a key reason is medico-legally, and for us to know and understand the skeletal relationship, the dental relationship, and have some evidence to back that up. And to be able to understand the lat ceph and get the numbers that you need from it is a pretty important skill. Something else that I learned from this was the different options we can use to treat a case. And so that's something that the reason I'm doing the mini masters, in my opinion, and I've said this before, is because I want to see and hear about the whole range of orthodontics. I want to know what's out there, and I want to know that I'm not pushing my patient into aligners when they could be having a simple fixed appliance or a shorter treatment in fixed braces or something like that. So So something I learned about in this course from Jeff was the carrier appliance. And so this is an appliance, as you can see, it's basically bonded between the 6 and the 3, and then there's an elastic down to the lower molar. And this is something that can improve the sagittal relationship before you actually start with appliances or aligners. And now this works by uprighting the 6, rotating the 6 into that correct position, like I was saying before, that the line between distobuccal and mesioplatal then needs to intersect the canine. But that simple rotation often can help us get some space to fix simple AP discrepancies. The other thing this does is distally displace the entire segment, so that obviously helps in a class 2 situation. These little things are the things I want to know before I embark, and particularly in AP corrections for my patients. I think we need to know more than just aligners or just fixed, and that's what I'm happy to have got a step 1, I guess, in the mini masters with OrthoEd. Now, if you're interested in this, you can get a discount through Dental Head Start. If you're a recent graduate, less than 5 years out or 5 years out, you can get 10% off. Go to dentalheadstart.com/orthoed and you can find those details there. And if you want to learn more about what we're doing with giving, you can go to dentalheadstart.com/giving to find out more about that and perhaps even contribute as well. So next episode, we'll talk a little bit about kids and some of the things that we want to see and catch in them before they grow too old. And the next thing we'll do after that is finalize my clin check and finally get me in some aligners and actually remove the 3-2 so that we've got some space. So I'm excited to start that. It's going to be interesting actually wearing aligners, but I'll let you know how it goes. Cheers.